Okay.
5-4.
Hi everyone, lovely to see you again, and I'm sorry that we've been quiet for a couple of weeks. There was a period of time where we were online with you pretty much every week, if not twice a week. And as I said at the last Q&A, we would always have a position whereby actually no news meant that we really didn't have anything more to tell you. So what I thought we could cover today was what has kind of happened so far with vaccinations and what we know currently going forward. So let's just recap. We are responsible for vaccinating patients in what's called priority groups 1 to 4. And you would have heard that discussed by the government, saying that everybody in any group and categorised 1 to 4 have to be offered a vaccine by the 15th of February, and if they say yes, they are to have their vaccine by the 15th of February. Now, to be clear, we have offered it to all of you in groups 1 to 4. Okay, so that's everybody over the age of 70, anybody clinically extremely vulnerable, anybody living in a care home. Now, they were the groups that we were to offer that vaccination, and indeed we had 44 people left, and they are being vaccinated on Friday. So hopefully after that, everybody has had multiple invitations, multiple opportunities, and we do know that those people that couldn't get to Larkhill, and we're really sorry you couldn't, have gone to the City Hall for that as well. And it's really good in terms of that system approach whereby you do have options. But I am aware that those of you who came to Larkhill actually had a really good experience, and the amounts of compliments, thanks, sheer kind of feedback that we've had has really been very, very rewarding for all of us to be able to move that forward. So I'm so thankful for that. That is absolutely brilliant. Now, in terms of moving forward from there, what I can summarise is that we are on a position of having vaccinated 2,555 people. And of course, we've got 44 to go on Friday, and we have 14 patients left to vaccinate who are currently housebound. And then we have completed that group. So I'm just going to have a quick look through the questions before going any further to see whether or not we need to discuss anything else about that. So let me just have a look before we go into the next stages. Okay, so the next bit to then talk about, having looked at the questions that have been posed so far, is about the second dosing. So when you were vaccinated with your first dose, you gave consent at the time to be revaccinated within the next 12 weeks. Now, we believed at the time, and we were told at the time, that you would be vaccinated at week 10. So those of you who were vaccinated during the first cohort, so that was the 16th and 17th of January, when we had our large lot of clinics in, that meant that you were being revaccinated with your second dose on the 27th and 28th of March. And then our second lot of kind of big clinics happened the following week, the 3rd and 4th of no, hang on a minute, I've got that completely wrong. 21st, 22nd of January. So we looked forward to that, and then we were looking at Good Friday, the 3rd of April, and Easter Saturday, the 4th of April. Now, what's coming out now as current kind of anticipation is that we are going to look at 11 weeks. However, NHS England have said that they will be releasing the schedules for second dosing within the next week. So I was hoping to have had that by today's meeting. We haven't had it, so we are expecting it at any point so that we know and we can start planning when you'll get your second vaccine. So that's what's coming. Please, there's no need to contact us. We know who you are. We will be going out to you and mopping up everybody as well, in terms of those people that perhaps haven't had letters, because we know Royal Mail were quite slow for us, unfortunately, when we tried to get out to you, text messaging, etc., to try and reach out to you so you know what is happening. But once we know when those clinics are, we will start planning. And the great thing is it's still quite a distance away, so we have got time to kind of plan this and know what we're doing when. Whereas when we did your first vaccines, we were sometimes only given 3 days, sometimes even maybe a little bit more, but not much. So that's just coming into Forum now in terms of where we're going and what we're doing. So that's about kind of second dosings coming to see us. The layout will be exactly the same. You'll go through all of that process again, and you'll have your timed appointments to come in, okay, to be able to move through. And even though some of you came on the very last kind of afternoon before the snow came and landed with us, and some of you just kind of pitched up because that's what we invited you to do, we will be coming back to you to give you an invitation. So you do have a timed appointment. So leading on to that is to say a big kind of thank you to all of you who have given us presents as well. So we've had quite a lot of cake and biscuits, different things arrive, which was awesome. Now, some even brought them to the clinic. However, I'm so sorry to say I actually didn't pick up on whose name, who it was to come back to, and I'm so sorry that we can't kind of give you a personal thanks, but know that they were much appreciated. And then the other kind of thanks before moving on to the next kind of section is very much to say thank you to our volunteers who supported all of us and of course you through your journey of the vaccination clinic to make sure that everything was kind of kept safe and well run throughout the day. So yeah, thank you to all of you as well, those of you that are on the call. So let's move on from there. I can see that there aren't any questions about that. So what I will then aim to do is talk about the next kind of phases in the cohorts that are coming forward, and I can see that there are some questions already posed about what's happening next. So we have cohort 5 being invited next, and again we are waiting any time now to find out when our deliveries will come to start offering you that vaccination. Now cohort 5 are those people who are aged 65 to 69. But we haven't been given a date yet about when that vaccine is coming, but you are next in line to be vaccinated. And the next cohort after that, and I'm just going to get Chet to talk to you about that, is about cohort 6 and who are the people that are in cohort 6. So Chet, if I just pass over to you, can you do your kind of information sharing about who's in cohort 6?
Got it. Good evening, everyone. I hope you're all staying warm in this current environment of it being absolutely freezing outside, and it's going to get colder tomorrow. So do keep yourselves wrapped up. So thank you, Anna. Yes, the cohort 6 is basically 65 years, i.e. 64 years and under. And they're going to be sort of more of the sort of moderate risk groups in that. So, of course, as soon as we get the notification from NHS England that the vaccine will be heading our way and that we can start vaccinating the cohort 6, we'll be reaching out to you to get this all done. But I just want to say a massive thank you again to everybody that's helped us put this together. You know, Anna and all the management team who've made it, including the military as well, who've made it possible for us to deliver the vaccine so well to our entire patient cohort. And the final thanks also goes to Iceland and Waitrose, who thankfully gave us some donations for the volunteers over the weekend to give us some drinks and snacks and things. So it's just been a massive welcome of support from everyone to get this rolling out. Over to you, Anna.
Hi, okay. Well, that's really good, Chet. It's lovely, but you kind of didn't tell people who was in cohort 6. So just to recap on who was in cohort 6, they are people that are aged 16 to 64. They have underlying health conditions that have been specified by NHS England. They're either or they're carers, and indeed, as Chet said, they are at moderate risk of COVID. So they're the criteria for cohort 6, and I know that we've had lots of questions about that. That is the guidance that we currently have, and it is based in terms of information that's within your medical record. So we will invite you, as we have done for every other group, invited you accordingly when we get the nod to be able to do that. But let's be clear, first of all, cohort 5 is next. That's our key priority. We have I'm just checking the numbers, 969 patients in that group. Okay, now what's reassuring for all of you is that we get a vaccine supply that will cover all of you in one hit. So you will all be coming in one go to be able to get that vaccine over a couple of days. And then after that, we go to cohort 5. Now, we may have some vaccine left over into, after our vaccine clinic on Friday, and we do have the OK that should we have any left, then we will be offering it to people in cohort 5 to prevent any wastage. We are kind of balancing things, and at the moment we don't expect that, but just letting you know that that's the case. And I suppose on that note is that to say that if there are any key workers, so those people that are in priority 2, and it's really clear, you will know if you're in priority 2 and you need that vaccine, please can you contact us, because we'll try and get you an appointment for that, but you will need to tell us who your employers are, because we just have to kind of make sure that that's all sound and solid. So hopefully that has all kind of covered those aspects. Now, we've got a question here from Steve who says, when can over 60s expect to be called forward? Are Salisbury residents expected to travel to Lark Hill? So in terms of the over 60s, that's in group 7, because of course we've got cohort 5, which is 65 to 69. We have cohort 6, who are 16 to 65, who are moderately at risk, a carer, or indeed have underlying health conditions. So they are the next group in, and then of course the 60 to 64 are in the next group along from there. Now, although yes, okay, there is a drive out to Lark Hill, we understand that. There's a drive for those people that live in Avon, for Durrington, etc. But what we can guarantee you is that it is a very safe service. It's very efficient, it's free parking, you're close by, and the system is quick to get you in and out to be able to get that vaccine quickly for you. So what I'm just going to do here is that there's a question here, Chet, about any news on long COVID clinics. So while I just check the questions, if Chet can just answer that question, that'd be great.
Hi, sorry, Anna. I've had some background noise. I didn't quite hear which question I was answering there.
Okay. You can't hear me, can you?
I can hear you.
Oh, okay, you can hear me. Okay, fine. So that is, let me just have a look, from Mandy B. Any news on long COVID clinic?
Yeah.
Yeah.
So our long COVID clinics are set up and slowly accepting referrals. So depending on which practice you belong to, I would get in contact to either Avon Valley practice or Sarum Health Group, and they can then make that necessary referral. I think the speed of referral, though, is still very, very sluggish. I can't give you an exact time of when you're going to be seen, but there is a referral system set up with a referral form that your practice would have to go through to complete to then send it on to that clinic. Okay, so please get in touch with the individual surgery that you're registered with. Back to you, Anna.
Hi, so I'm still just going through the questions. So there's another clinical question, Chet, for you. Are side effects from the vaccine a good thing, as they mean the vaccine has worked?
Really interesting question. Basically, the side effect profile of the vaccine doesn't really have a correlation with how significant an immune response you're getting. Of course, there are things within it which may give you a mild sort of allergic response, the sort of heavy arm and the sort of headache and everything else. So there isn't really any correlation to what you're suggesting at the moment, though I'm sure more and more evidence will come out as we continue vaccinating the vast numbers of people we are. So back to you, Anna.
Cool, thank you. So there's a question here about being an unpaid carer to a clinically vulnerable teenager, and whether or not you'd be in cohort 6. Now, indeed, I have asked exactly that question of NHS England to clarify what they consider to be a carer, so that we can apply that principle across the way, because we don't want kind of local flavour here. We need to understand what they consider to be a carer, and we will apply those rules. And I have asked that exact question because I have to be honest, it's not, I'm not sure of the criteria, and I can't quite work out exactly how they're going to apply that. But let's hope kind of pragmatism resides here and overcomes all those things. So we're going to just move on to the next question, and that's from Richard. So I'm just going to go back to Chet because it's quite good to listen to him rather than listen to me the whole time. And that's, will there be a 15-minute rest with the second vaccine? This is awkward, isn't it, with this? We're waiting.
Brilliant. Yes, I see the live sign. The answer is, depending on the vaccination that you had first time round, our aim is to give you the whole aim is to give you the second vaccine of the same type. So if you were given the Pfizer vaccine first time round, you'll be given the Pfizer vaccine second time round, and there will be a 15-minute wait. As for the AstraZeneca vaccine, if you had that first time round, the guidance is that you're not to drive for at least 15 minutes if you drove to the centre, and again that would be applicable on the second vaccination too. So so we just want to make sure that you're all safe once you've had your second vaccine. So we'll be directing you as to how long you got to wait for and where you've got to wait. So we'll be coordinating all of that for you. Okay, thank you. Back to you, Anna.
Hi, thanks, Chet. Now somebody's come back and said I didn't answer the question as to when over 60s will be invited. So if it is age people 60 to 64, and I'm really sorry I wasn't kind of clear on that, is that it will be after cohort 5 and cohort 6. So bearing in mind that we've got to, as a nation, it's not just about locally vaccinate all of our people who are aged 65 to 69 first. Then we need to go and vaccinate our 16 to 64 with that moderate risk. Let's call it that in its simplest form. We then are going to the 60 to 64s. And I have to say, your estimate is as good as mine. We have been very clear in terms of this. Our administration of the vaccine is dependent on vaccine supply. It is not the logistics to get this vaccine to you. It's not based on capacity of workforce or capacity of premises, etc. It is purely based on vaccine supply. So the quicker the government can get more vaccine in, the quicker we can vaccinate with you. And I'm so sorry that I can't tell you when that might be, because we are waiting right now to find out when when the next vaccine will come for cohort 5. And of course, and after that it will be cohort 6, and then after that it will be cohort 7, which is the cohort we're talking about. So I'm really sorry that I can't give you any more, and I wish I could. If I could, I would, I promise, to be able to do that. Okay. In terms of, and again that goes, I know that I can see that Chet's answered it, but in terms of do you know which vaccine cohort 5 will get, we don't know. We have no idea at all. We will get the vaccine whichever is supplied to us, and that's the vaccine we would use to be able to do that. And then in terms of, someone else has asked, refer back to the cohort and age questions, is the system clever enough to pick up someone who is 70 on the 16th of April and they're 70 and a higher cohort? So yes, in terms of that it is. To be able to do that, we'll keep running our reports that keep running, telling us who needs to come into which group and who has and hasn't been vaccinated. So we keep doing that, and as we keep getting supply of vaccine, so we keep bringing people in. And remember, that is why the government has given us the okay that if we've got vaccine left, is to be able to go to the next cohort group, as in the next age group down from there. So fingers crossed we will be able to keep up with everything that's happening. So how many people are in cohort 6? Okay, so I have actually written that down. In Avon Valley practice, that's 822 people in cohort 6, and in Sarum Health Group, so that covers Millstream and Lark Hill, there are 953. So in terms of that, that's how many people we are vaccinating. As I said, just to recap, cohort 5, in total we have 969 people. to be able to do that. And of course, we do have people that are registering with us as well. So those numbers do fluctuate a little bit, and sadly, some people move on or sadly pass away. So they do move, those figures. They are not set in stone every minute of every day. They do fluctuate. And just another question here in terms of Teresa said, I joined late, so did not hear the date the cohort 5 vaccine will start. So we are waiting from NHS England to be told when the vaccine is coming. We are hoping it's this week that we'll be told, but they are getting the vaccine supply kind of organised, and therefore we're expecting it in however length of time that will be, but enough time to be able to invite you all in. And like I've said and promised you, we will tell you when we know. Now there's a clinical question, or there's a couple of clinical questions here, Chad. So if I can just ask you the first one. My sister is in hospital in Devizes. Will they be offering the jab, or will we offer it to them?
Hi. I'd love to be able to answer that question fully, because I'm unsure of the reason why your sister might be in the hospital in Devizes. If it's for reasons of recent COVID, we're unable to vaccinate anyone for up to 4 weeks after they've had a positive test. So it might be that they are unable to offer that vaccination at the time, and we will have to then work out 4 weeks afterwards how we're going to administer that vaccine. The various hospitals are offering it in, because they're part of the same pool as us in getting their vaccinations. So they may not have a set dosing of vaccinations to give, and therefore when your sister does come back to the area, let us know so that we can look at how we can get to vaccinate her. So I'm sorry I couldn't answer that fully, but hopefully it gives you an indication of how we're trying to work across the patch to get patients covered. Back to you, Anna.
Great, cool, thank you. And I think that's an important part actually to just recap on, and I don't think that was made as clear as what we could have done in hindsight, and that is the fact that you can't be vaccinated if you've had COVID 4 weeks prior. So if you get an invitation from us, or indeed where else, and you find out and you know that you've had COVID in the last 4 weeks, know that you cannot be vaccinated. So if you turn up to be vaccinated and you've tested positive, we will have to turn you away. That's part of the guidance. We're not allowed to vaccinate you if you are COVID positive within the 4 weeks of the vaccination date. That's for first vaccine and second vaccine. To be able to do that. The other point actually, in terms of making this clear, that I remember a patient reminding me to make sure that you're all aware, and that is the crossover of the vaccine. So we're aware that NHS England sent letters to patients inviting them for their vaccination when actually they'd already had it with us. Indeed, there was a crossover nationally whereby people had the vaccine that weekend, but the letters had already been generated, and therefore the electronic systems don't update in time to be able to stop the letter run or understand what was going on. So there was a slight crossover whereby we're aware that some of our patients received letters in error by NHS England because you'd already had the vaccine from us. I'm really sorry for that, but I think it's kind of understood when you think that there is always going to be a crossover if they send the letters the same weekend that we're vaccinating, and they don't know across the country who's vaccinating when, even though they kind of do, but you know, we have to bear with them for that. Okay, so we're going to go to another question here, and that's another clinical question, Chet, so get ready. And that's, what level of immunity would you expect following the first vaccine, or do we wait until the second before we can feel more secure?
Okay, I would understand this to be a big concern to pretty much everyone on the call today. At the moment, the evidence for the AstraZeneca vaccine in particular is that it does offer about a 70% immunity factor to significant illness. So let me classify that. That's significant illness. That means it doesn't mean that you can't contract COVID, it means that the likelihood of you ending up in hospital, stroke into intensive care, there's a much greater reduction in that. So the answer to your questions in two parts is that the immunity level is there enough to try and prevent serious illness, but not completely there to try and prevent you from being unwell with it at all. So to feel generally safe, you must practice the rules that the government are advising to everybody, even though you have been vaccinated. And there is a period after the second vaccination where, again, you still need to be performing the government guidelines to feel totally secure. But I would continue, practicing face, and make sure you're washing your hands. Back to you, Anna.
Great, thanks, Chet. So I'm going to ask him some more clinical questions here. So it says here, if you're in your 20s suffering from epilepsy, will they be in priority group 6? And Chet says nodding at me, so he doesn't even need to come online. So that is it. So you're on. Oh, hang on a minute, it's flicked. Hang on a minute, it should be coming back to me because I've got another question to ask. Okay, so it's come back to me. So we had a slight IT issue there, whereby we were kind of getting ready and Stuart pressed the button, which is cool, but equally stopped our flow a little bit. So just to be clear, if you're in your 20s and you suffer from epilepsy, under the current guidance, you're in cohort 6. Okay, so I'm just going to move on to the next clinical question for Chet, and Stuart, get ready because we're going to move over. I mean, we're still getting used to this, aren't you? You think we'd be pros at this by now, but equally, I give mixed messages to Stuart, and bless him, he puts up with me. So, given some people do not know they have COVID, or may even have it at the time without knowing, what happens if they have the vaccine? And I suppose that's a very good question if you know that you've been positive, we're not allowed to vaccinate within 4 weeks, Chet. So what happens if actually you're asymptomatic, you have no idea, and then you have the vaccine? Hang on a minute. Stuart's trying to work his magic. Oh, there we are.
It's calm. Yes, I can see the sign. The answer is, I mean, the main reason why we want to delay the time point of patients from the date of when they've been diagnosed with COVID on their swab results to 4 weeks is because we know that if people go for retesting within those 4 weeks, even though they aren't having any symptoms, they can still come back positive. And that's not because you're shedding the virus or anything else like that. It's just because it's already killed and it's sitting in the system. Now, there is a small possibility as a big side effect that people do often develop a temperature once, you can develop a mild fever once you've had the vaccination. So what we want to make sure is that those patients who develop a mild fever that is continuous, they go for a COVID test. Now, if they go for a COVID test and it comes back positive, is it a reinfection, or is it a new infection, or was it something that they've just had 4 weeks ago? So that's the reason for the 4-week rule. But there's no, because the vaccines aren't live, there's no detriment if you are currently suffering with an asymptomatic version of COVID. And 10 million people have been vaccinated. I'm sure some of those patients would have had COVID at the time and they just didn't know it. So there's been no detrimental evidence coming out from that. So yes, I'll pass that back to Anna, I think. Fingers gone.
Great. So that actually concludes our questions. We've answered all of them that have been posed this evening. It's now coming to 6 o'clock. So thank you again for joining us. We hope that you find it useful again. It was lovely to meet some of you in person at the vaccine clinics as well. And we're sure to see you again soon. So yeah, take care, keep safe. And when we know more, we'll let you know. We promise that. And if you won't hear from either Chet or I next week because we're both on leave, all being that we don't have to actually vaccinate, and then we'll be back in action. So fingers crossed we can have a week's rest, and we'll see you then. Okay, take care. Bye.